Is the microphone working? Okay, good. There we go. Okay, sorry about that. Yeah, all right. Now you know how my children felt when they were young. Without further ado, we're going to start with a prayer from Pastor Broden. And, you know, I'm a big believer that there are many paths to salvation. I feel that this is a historic place in many ways. It's a holy place because it was built by our founders. And a library is very special to me. My mother did not attend college. She became a community volunteer and went through everything, started the drug prevention program, and one of the dearest things to her heart was that she saved our town's library. So without further ado, we're going to give you the Free to Care Conference, and we're going to hear from Pastor Stephen Broden, who's going to lead us in a benediction.
Good morning. And you guys sound real enthusiastic, and I'm so glad about that. Your energy really, heightens everybody up here. But I want to share a couple of words before we enter into our prayer. Just a couple of scriptures that I think that frames, I believe, the motive behind why you're here and what we're attempting to do with Safe Harbor. The scriptures in Deuteronomy chapter 25 and 12, 13 and 15 says this: "You should not have in your bag differing weights, a large one and a small one. You should not have, or you should have a full and just weight, and you should have a full and just measure, that your days may be prolonged here on earth." Leviticus 19 and 35 says this: "You shall have, or you shall do no wrong in judgment, in measurement of weight and or capacity." Proverbs 11 and 1 says this: "A false balance is an abomination to the Lord, but a just weight is his delight." Differing weights are an abomination to the Lord, and a false scale is not good. I think those scriptures appropriately speak to what's going on with the middleman. He's got his finger on the scales, and he's producing income for himself at the expense of the citizens of this great land, and forcing on us a dependency upon the government. That is socialism. That is socialism. So we entreat God in this moment. Eternal God, our Father, as we enter into this moment together, men and women who are concerned about where health care is in America, that you would grant to us insight and wisdom as we consider the issues that are before us. Give to us the capacity to respond in a way that produces the results that are favorable for this nation, for the citizens, and for those who are in great need of medical assistance and help. We know that you're able to do exceedingly and abundantly above all that we could ever hope or ask for, according to the power that worketh within us. Let that power demonstrate itself, yea, even today, as we consider a pathway to results. In Jesus' name, amen.
Well, Pastor Broden, thank you. It's always great to get to listen to you speak. You have such a great way with words and such passion, wisdom, and insight. I want to thank you all for coming. I'm C.L. Gray. It's been amazing to be able to work with our group of physician leaders like this, with Marion, with David, because these are such transformational times in the future of American healthcare, in the future of American medicine. And really what's at stake is what it means to be a patient and what it means to be a physician. So we need ideas. We need kind of the experience that the people in this room bring. So we're going to hear from an amazing number of speakers. We want to thank you all for coming. Thank the congressional leaders and staff for coming, Congressman Marshall's office for sponsoring this. And without further ado, I think we'll get started. Marion and then David.
So I was meant to recognize special people in the room, and I think what I'm going to say is that it's really all of you, you know? So I'm not going to recognize any one single person special. I do want to say that working with David and CL has been an absolute pleasure, and putting this together has been an honor. And what I really felt so strongly was how people just kept on coming and saying, what can I do? How can I help? Again and again and again and again. I've been surrounded and cocooned by some amazing people. And you know what? Don't feel sorry for me. It's all been a lot of fun. We're all staying in a house together that one of them rented. And we had a grand old time last night, so don't think I was stressed. In any case, you're all special. I want to thank, though, especially, I think all of us would reflect on this, those who are not here and who have come before us and mentored us and taught us and been there to allow this day to be possible. So without further ado, I'm going to turn this over to David Balott.
Good morning. I was hoping for a better response than Pastor Broden got. Thank you, thank you. No offense, Pastor. Healthcare is the relationship between doctor and patient. The reason for the complexity, the cost, and the problems that we face today is because of the interruption between those two entities. We're going to talk about some of those that have wedged themselves between that relationship today. Thank you all for being here today. It's very important that we represent our patients, our communities, our states, and our nation. As far as what's going on today, since this effort has started, we've seen some remarkable things happen. The administration has started with their proposal that is currently in the comment phase to eliminate the rebates for the pharmacy benefit managers for Medicare and Medicaid, and we have till April 8th to submit your comment. If you haven't done so, I would encourage you to do so. That group also needs to hear your voice. We've also seen the Braun bill that is doing some good things that will contribute to that effort. And we've also seen a few smatterings of proposals that have come out of energy and commerce. And we're going to learn more about those today. And this is going to be a wonderful day, everyone. Please get something to eat, refresh yourselves, but be engaged. This is an opportunity for not to enjoy this conference, but to take what you learned today to do something into the future. So thank you so much for being here. We look forward to the community, the conversation, and the engagement.
Well, to get to our first panel, I want to introduce a good friend of mine, somebody it's been a privilege to get to know, and Bob Campbell, Dr. Campbell. He's spent probably the last 7 years committing, I'd hate to say, almost every waking moment of his life when he's not in the hospital, to sorting out this issue of drug pricing, of the middleman. And I was honored to be able to write a paper with him that actually found its way to the hands of President Trump. We've started to see some changes on the administrative side to deal with this. Now we have to move it to the congressional side. So it's been a privilege working with you, Bob, and for your time, your energy, your expertise, your leadership. And if you want to introduce your panel and pick it up from here, we'll talk about drug pricing and the middleman. Bob?
Well, thank you, and that was a wonderful ceremony. We're going to get into a little bit of nitty-gritty policy now. We have so many wonderful leaders in medicine, and I want to thank everyone for being here. I often tell people, you know, it is not the 1%, but the sub 1%, the 0.1% of people who make things happen. And most people get by. They go through their lives, they get by. Somehow there's people here who take care of their families, they have their professional lives, they work, they have their hobbies, their interests, and then they also manufacture time to do wonderful things. And it is that sub 1% that is the only slice of our society that's going to fix this. The politicians won't do it. The agencies won't do it. We need physician leaders now more than ever. So with all that having been put out there, I'm going to start with a gentleman, and if he didn't already have, well, his organization is called CPCC. I'm going to let him tell you what it is, because if I say the name, I'm going to want to keep it, because it's a righteous name. David Balto is a former attorney at the FTC. He has been doing wonderful things for patients and physicians, it turns out, because what's good for our patients is usually good for physicians. So with no further ado, David Balto, come on up here and tell us what you know about middlemen.
Thanks so much. It's such a tremendous privilege for me to come before and speak to you today. You know, in the typical life of those folks in Washington, we're inundated in an ocean of lobbyists for intermediaries, PBMs, GPOs, health insurance companies. And when you walk into those congressional offices, you're going to be a breath of fresh air. You're going to be a breath of honesty and the truth. And I hope you understand that. You're going to have to go and educate these staff people who think that it's the health insurance companies and the PBMs who run the healthcare system, that it's really doctors and their relationships with patients. And that's why it's such a privilege for me to speak to you today. Now, perhaps you think today's message is complicated, and a picture speaks for 1,000 words. So going and picking up on the pastor's comments this morning, when you're done today, go and walk over to the reading room, and you're going to see a series of murals by Elihu Vedder, an artist in the late 19th century. And on the right side, there's good government, and on the left side, there's bad government. And there's this mural that shows that someone's giving a side payment. This is the bad government side, in case you get confused about it. There's someone sort of giving a side payment to government, which looks sort of lascivious, and their factories are working, and the poor good and the poor honest person, their factory's not working. That picture depicts what's going on in our healthcare system today. We permit intermediaries to play this complicated role, and through that, because of a lack of transparency and competition, a tremendous amount of wealth is taken out of the system, and that's bad because it increases our costs. But you know firsthand, the real cost is it prevents you from practicing medicine. The thing you worked so hard in medical school to do, the thing you've been committed all your life to do, you're prevented from doing that because of the complex and anti-competitive system we have for basically determining where the money goes. Today, I'm going to tell you that a lot of money goes to that. I'm going to talk about PBM abuse. By the way, we have these two websites, and you can have my slides afterwards if you give me your business card. One's called pbmwatch.com, which documents all of the bad things, most of the bad things that PBMs do. We take up a whole server at Google. And the other one is, our organization is called the Coalition to Protect Patient Choice, otherwise known as the CPPC. And there we keep up with everything that goes on in terms of, that was a coalition formed to go and protect consumers' rights in healthcare competition issues. So here's a simple message. You're going to go home tonight, and your son's going to say to you, "Ma, tell me, what makes a market competitive?" So I want to answer that question to you. You need three things for a market to work. You need to have choice. That's obvious. You need to be able to play competitors off against each other. You need to have transparency. You need to know what you're buying and for how much and what you're really getting. And finally, when you have intermediaries, such as PBMs and GPOs, and health insurance companies, you need to make sure there's not a conflict of interest. You're hiring these people to do a service, you've got to make sure that they represent your interest. My simple message today is on all three counts, the PBM market fails. Now, I used to do this by myself. I was a nice, liberal, antitrust advocate, and I felt sort of lonely saying the PBM market was anti-competitive. But alas, last year, the Council of Economic Advisors, that's these people who work down there near the White House, said that the PBM market is anti-competitive. There are 3 PBMs that control the market, and this enables them to make outsized profits. In other words, the market is not competitive. Now, ask any pharmacist, they'll tell you that the market isn't competitive. They can't live without these people. And what they said is policies to decrease concentration in the PBM market and other elements of the supply chain would actually benefit consumers. So PBMs will spend this time. Just so I want you to know the story PBMs say. Oh my God, people would die without PBMs. Drug costs would skyrocket. We're just there negotiating on behalf of consumers, and we're trying to protect consumers. By the way, for anybody who thinks for more than a millisecond that PBMs are on the side of consumers, remember that PBMs had clauses in their contracts with pharmacists that basically tied and gagged them and prevented those pharmacists from telling consumers where there was a lower cost alternative for drugs. They gagged them until Congress prohibited that practices last year. But they'll say, oh, no, we only make a small portion of money out of the total PBM system. Their $89 billion of rebates, we take only $11 billion of that. But that's still 12 or 13%. To compare things, when you buy something on Visa or MasterCard, they take something like 1 or 2% of that transaction. They engage in a variety of shell games with a variety of other fees that they charge plan sponsors to go and increase the amount of money they make, even if they say they're only making something like 10% of the rebates. The PBMs are some of the largest corporations in the United States. Express Scripts and Caremark are respectively numbers 7 and 22 on the market. So just think about all that money that goes for just the simple process of moving money and information. We're spending a phenomenal amount of money for just that simple process. So that was element 1. We see lack of competition. What about transparency? One day, be a plan sponsor. Be someone who actually hires a PBM. If those entities say, excuse me, I'd like to know what rebate you're getting on this drug or that drug, the PBMs say, I'm sorry, you can't look behind the curtain. That information's totally proprietary. PBMs fight against transparency tooth and nail to prevent payors from being able to know what the actual amount of the rebates. Why? Because in a transparent system where payors would actually be able to secure the amount of the rebates, they'd be able to make the PBMs compete for better and better rebates. So that lack of transparency allows them to pocket a greater amount of the rebates. And play the spread. So they will charge, for example, in Ohio, they determined that the PBMs were saying to the state that they were reimbursing pharmacies at one level, but they were actually reimbursing pharmacies at a lower level. Now, the most important issue involving PBMs, the reason why there's a congressional hearing a week from Tuesday, by the way, just to put this in context, PBMs aren't regulated. You almost need to go to law school to learn how to practice medicine. You always have to deal with lawyers to think about all the ways you're regulated. PBMs live in a totally unregulated environment. And next week from Tuesday is the first time Congress has held a hearing on PBMs. It's time to uncover the curtain. Okay, so let's go to conflicts of interest. The most important one, which was detected in the recent proposed regulatory action, is the question of rebates. So PBMs are supposed to lower drug costs, but because they can pocket a share of the rebates, they actually want a higher list price, so they get a higher rebate. Now, you know this is illegal because you have to abide by an anti-kickback statute. You can't get money from someone that you're referring, that you refer business to. It's a bedrock principle. Now, there was this narrow carve-out that was misinterpreted that permitted PBMs to go and engage in securing these rebates. Now, the problem got much worse a few years ago when PBMs became larger and larger through a series of acquisitions. All of a sudden, they realized that they could make a lot more money by raising the list price. And what did they care about the list price? They're not a consumer dealing with a deductible and then demanding higher and higher rebates. So what you see over the past several years are PBM rebates, list prices significantly increasing, and PBM rebates increasing substantially. So there are a number of situations where even though drug manufacturers wanted to lower their list price, they were unable to because the PBMs wanted higher and higher rebates. That's what the proposed Part D rule that was mentioned earlier seeks to address. This is what the result is. If you just look here, this is just a short period of time, and unfortunately I lost space at the top. But just over about a 13-year period, their profits skyrocketed from about $1 billion to now it's well over $11 billion in rebates that they pocket. Again, that's just the big two. Again, if you think about the healthcare system, who is producing